It's an extraordinary story. I must say, it passed me by. Family doctors across England, we will get the outcome of the ballot at midday today on whether to take industrial action over a row over contracts for GP services.
So this will be the first walkout in 60 years. If you can't get an appointment now, well, good luck doing it if the strikes start. We're joined by health expert and commentator Thorin Gavin. Good morning, Thorin. Right, what's your position on this? Do you think the doctors, the GPs, should be striking?
So, to be truthful, as you know, I'm a practicing pharmacist, so I don't want anyone to be striking. What I want particularly is what they're looking at here is the GP contract, and they're saying it's not fit for purpose. And I think a lot of the primary care contracts are not fit for purpose. And what we really need is some joined up thinking when it comes to healthcare. So what I'm worried about with this is people are effectively, there's going to be fewer appointments available is one of the options. So they're looking at 9 forms of protest, and one of those is reducing the number of appointments available. And that will mean that some people will therefore have to go to 111 to out of hours, and they'll end up coming to the pharmacy as well. So that's where I'm worried about it. I think, you know, we've got to think about where are people going to go if there is a reduction in the number of appointments.
So just to be clear, Thorin, it's not about their own pay, because they're on about £153,000, £154,000 a year on average, these GPs. It is the money they get to run their service, so perhaps what they pay their receptionist, how they run the surgery. And I know the pharmacy, your world in pharmacy, you also have an issue with the government about the money you're being provided for drugs. Is it all part of the same problem?
Yes, I think this is a lack of joined up thinking when it comes to healthcare, because we keep saying to everyone, we need to stay well for longer, we need to look after ourselves, we need to almost avoid going to see our GP, don't we? Because we need to do as much as we can to stay well, and therefore we need to make sure that the funding is there so that when we need to see our healthcare professionals, you know, we want to be going into well-maintained buildings, don't we? We want to make sure that we've got what we need to do our jobs. But really, I don't think any healthcare professional wants to take part in any sort of protest or strike action. And this is very much a sort of reduction in the maybe the level of care provided in terms of appointment availability, in terms of there are some restrictions as to what GPs are allowed to prescribe, for example. So one of the proposed action is that they're going to throw that out the window and prescribe what they want to prescribe for that patient. So we could see some benefits for patients, in fact, with this. But I mean, I don't think anyone wants to have to do this, and there is actually going to be some more protests from pharmacies actually coming up in September. So people are going to be sounding the alarms in their pharmacies because they're concerned about the levels of funding. So I'm concerned generally for patients, because nobody wants to be going into an environment where your healthcare professionals are saying we need more money to do what we're doing. But also, I don't think it's just about money. We've got to think about the IT systems, how things work. I mean, even myself with the IT outage last week was an absolute nightmare just trying to navigate the system. So I really feel for patients who are also having to navigate the healthcare system, which is sometimes just a bit too complex, and it doesn't always have the common sense that it should do.
Just explain to us you mean the Microsoft meltdown, Thorin? Is that what you mean? And what was the effect for you then, practically? What happened?
Well, I don't really go and see my GP. I don't get a prescription that often, but I was unable, as a practicing pharmacist, I was unable to get my prescription last week, which actually made me much more unwell than I needed to be. And I got passed from pillar to post around 111. And as you can imagine, I knew what I needed. I knew where I needed to go, and that outage obviously meant that my electronic prescription couldn't go across to my to the pharmacy. So I think people don't. Or what's frustrating to me is I was seeing touch points in how I was accessing healthcare, which should have been should have been done differently. And I've raised that because I think it's important that we all try and improve the service in whichever way we can. But it is frustrating for patients. And I don't think, I mean, I was looking back, actually, you'll remember that footage with Tony Blair with someone talking about how long for an appointment and things like that. I don't think we're anywhere near where we would like to be in terms of access to appointments. But also it's about recognising that primary care and healthcare isn't just about the GP. There's lots of people in the GP surgeries who make wonderful things happen for patients. But also, you know, in terms of the community as well, there's people like the pharmacists who are there as well.
OK, thank you so much, commentator and pharmacist Thorin Govind there.
I'm baffled by this. The British Medical Association is frankly wicked. Just the week before the general election, they went on strike, junior doctors, knowing there was absolutely no prospect whatsoever that the outgoing government, we all knew they were going to lose, were going to say, fine, we've not paid them extra money, we've not given them their 30% pay, so we'll do it now. So what they did for that week was cause chaos, more operations, more routine treatment cancelled. Wicked of them to do that, and overtly political, designed to embarrass the Tories. Now here we have this. This ballot has been going on with BMA and GP since June the 17th. Why didn't they wait to ballot members when we get a new government in and give the new government the chance? I said earlier, look, I wish this government the very best. I want them to get things sorted out. A lot needs sorting. And yet they could be going on industrial action as early as tomorrow.
What we're basically moving towards now is very much a country in which those who can afford private healthcare
So what's going to happen?
are being treated, and those who can't end up going to A&E for the slightest thing because they just can't see a GP. They need to. This government needs to do something pretty radical.
They do.
I think.